Hello, ladies and gentlemen. Kalispera. Welcome to Delphi Economic Forum. I am Vicky Karatzaferi. I'm a journalist, and I am going to moderate the upcoming discussion, which is entitled Real-World Evidence and the Future of Healthcare. So let me introduce you to our exceptional speakers, starting from the ladies. Mrs. Agata Jakoncic, President of BOD PIF, Mr. Pascal Apostolides, General Manager, Greece and Cyprus, AbbVie Pharmaceuticals, Mr. Aggelos Tsakanikas, Associate Professor, National Technical University of Athens. It's a lot of information, let me read. Director of the Laboratory of Industrial and Energy Economics, Head of NTUA Tech Transfer Office, Research Fellow, Foundation for Economic and Industrial Research. Did I say that right?
Yep.
And Mr. George Kalamitsis, General Secretary, Greek Patients Association. So, FDA, the US Food and Drug Administration, defines real-world evidence as the clinical evidence that regards the usage and potential benefits or risks about a medical product, whether it is good or bad for the health of the patients. Unlike traditional clinical trials, that we have the necessary data elements that can be curated and collection mandated, the creation of real-world evidence requires assessing, validating, and aggregating various sources of data available through everyday routine, let's say, clinical practice. And the fact is that real-world evidence is fundamentally changing the future of healthcare. There is a lot of challenge hidden in there because we can have a lot of insights of what is good for each patient and not. And in a way, it might help the clinical trials in order to have some innovative products in the years to come. And of course, the stakeholders across the healthcare ecosystem use all this knowledge in order to do good to patients worldwide. So let's start with your speeches. Please, Mrs. Jakoncic.
Well, thank you. I have a few slides, I'll share it with you. And I'm really impressed. We started even 2 minutes in advance of the timing, So, anyway, I have a bit of, let's say, provocative title. So, can Greece be the center of excellence of real-world data and real-world evidence analysis? The future of the healthcare, it's all about digitalization. So, it will be either digitalized or there will be no healthcare at all. Now, for having a good digital healthcare system, data is sort of the oil, like an oil to machinery. Data is key for a good digital system. Now, where do we get data in general? As you can see here, on the slide, the data, it's everything. It can be electronic medical records, hospital data, registries, epidemiology, but not only that one, insurance companies and so on, but also social media data. Also about how many of us, we have a health apps, we are measuring the steps every day. So data is just everything and can be included into the good predictive systems. So we know about the data. Let's talk about connecting now the real-world data with the real-world evidence. Real-world evidence is sort of an insight. It gives us an insight of a value or efficacy of the health product and the clinical pathway. Now, there are three ways, what kind of putting three key pillars on the real-world evidence. First, it helps, to the healthcare professionals or authorities in terms of prioritizations. What do I mean by that? It means like it can be prioritized certain, let's say we have a burden of disease. That can be prioritized through to real-world evidence. It can be seen as a problematic, but it's also at a certain period of time that specific burden disease can be prioritized and put very specific measurements or performance indicators how we want to improve that burden of diseases. We want to work about the prevention. So the prevention is much better than the cost of the treatment. So it's all about real-world evidence, kind of prioritization. So it gives an opportunity to prioritize. The second thing it gives an opportunity to monitor. We can put a KPI targets, we can put a performance indicators, we can put wherever we wanted that, elimination of certain diseases, and so on. That is through to real-world evidence, can help that. And at the end of the day, as you will see later on, it's also support of economic growth. Now, can Greece be a good base for the real-world evidence, to develop a good real-world evidence? So as we said at the very beginning, we need a good data in order to fit into real-world evidence. Now, in Greece, we have a wealth of data. We have a good e-prescription system, which it is all captured in Nidica. There are terabytes of data there. We have, through to business intelligence, business insights, business in Ministry of Health, all hospital data. Then we have a consumption data in AOP. So there is numerous of the data. And to put things into perspective, in Greece is 11 million citizens, over 40,000 of healthcare professionals, 12,000 pharmacies. That creates on a monthly basis like 5.5 million prescriptions. How much data is that? And 3 million users, and so on and so forth. So the data is there. We'll need to find, how to find the communication of the data together. But moreover, let me touch a base as well of, I heard it also in the previous session, Resilience and Recovery Fund has put digitalization at the forefront. In order to be that digitalization to happen, data is key. Interoperability of the data will be key. The electronic prescriptions will be, and monitoring, health apps, that's all key. So we are not only what we have it there is also the future and potential of having a digital healthcare here. Now, what's happening on the European basis? It's not only in Greece, also from the European basis, there has been put as a priority as a European health data space. So European health data space is all working about interoperability of data, sharing the data among different countries, and also, of course, data protection and data privacy is there as well. And the other project, which is under Darwin, is helping in terms of regulatory framework. So we have the data, we have European supporting that, we have a project on RRF, so the things are there. We're there, is in place. What else can we do it? So I think today in Greece would be good to put a good national real-world evidence strategy together. The good national real-world strategy should be based on the 4 pillars. First of all, the analysis. I talked before, I touched the base, expenditure, utilization, epidemiology, all the data outcomes research, development of a real-world evidence framework, evaluating that, and put a good data privacy or privacy protection in place. So I think, one of the things is we have everything in place. The Greece is excellent opportunity, offer excellent opportunity to be the worldwide excellence center for real-world evidence because of the wealth of the data that is there.
Mind the time. Sorry.
Yeah, it's what, 1 minute?
Yes.
Okay, I'm done, more or less, 2 more slides.
Okay.
So, what does it need to help? A part of the national strategy, there is also the need, and we discussed it already before, the combination between public and private partnerships. So real-world data is there, data collection is there. There need to be agencies, in the intermediate agencies that will anonymize all of the data before the data is utilized for analysis and deliverables for public and private entities. So there we have already examples. Finnish data, in Finland, there is already FinData, which is kind of protecting how we utilize the data. Maccabi, Karolinska, there are already entities where utilizing the real-world evidence data, real-world data into real-world evidence outcomes. So, and the very last one, as we are in economic forum, I think we all also ask, what is the economy, in the real-world evidence? Based on the recent EOV study, which I think Mr. Tsakanikas will speak later on, but for every $1 million invested in the real-world evidence, it will creates the 2 million of economic growth, but not only that, it adds high-valued paid jobs. With this one, I think I'm done.
Thank you very much. I would like to add that Mr. Habibis isn't going to be with us today due to COVID-19. We all hope he gets well really soon. So, Mr. Apostolides, you're the next one.
Thank you, Mrs. Karatzaferi. My speech, and I'll promise I'll be within my time limits, is very much complementary to what Mrs. Jakoncic mentioned. I will just provide, before we go into real-world evidence and real-world data generation, the background, because Delphi Economic Forum is opening new roads when it started a few years back, and not only opening new roads, but also providing guidelines to the state, be it EOV, be it the Patient Association, be it the Ministry of Digital Transformation, that unfortunately is not with us, but the findings will be put forward to them, is that what we're really discussing, what we're really representing between Mrs. Jakoncic and myself, is the innovative industry. And the innovative industry is really, the pandemic has proven that it's providing solutions, first of all, to patients, to the health issues that we're facing, and of course, economic solutions. So the economy cannot move forward without having health. So if that's the framework, and meaning that the state has to pay attention to the public health pharma expenditure, then the innovation and the public health expenditure are interconnected. If they're interconnected, we have evidence to show that the industry can provide solutions based on innovation and based also on development in real-world evidence by doing clinical research. This clinical research in Europe is to the tune of 36 billion euros every year. We're not forced to do that. We're doing it at our own will. And Greece, unfortunately, is underrepresented in this segment by attracting less than 100 million. Actually, it's not moving forward, it's moving backwards. If we were to reach 500 million, which is the European average, if you divide the 27 states of Europe, we should be attracting about 500 million. This, if we attract 500 million euros every year, would mean over 1.1 billion GDP growth, what we're striving for, would mean 270 million in taxation, and thousands of highly skilled jobs that we're all striving to bring back our children from abroad and have the regain of the brain loss that we had over the years of the crisis. So if that's the basis, we should be looking forward in developing this framework by looking at the standards, the real-world data centers, the scientific gathering of the sources that we have on a global basis, which could be the electronic health systems, the patient registries, the clinical data that's generated. This is all translated as eloquently Ms. Jakoncic described, real-world evidence. Mm-hmm. And then we say, okay, what do we need real-world evidence for? Well, should we have to create something from scratch? No, because we discussed with Mr. Tsakanikas, since 2012, the electronic prescription. Mm-hmm. So we have a ton of data. Ms. Jakoncic described this as an oil well. I described this as we're sitting in a gold mine of data that could be extracted from the system, the electronic prescription system. And then you say, what about the funding? Well, also funding is available. We have through the RRF package, over, if I'm not mistaken, 278 million euros that could be been taken from the RRF, and the Ministry of Digital Transformation can take these funds to transform that digital health space from the real-world evidence that already exists and move forward. So I would say in conclusion, this is how we can take advantage of real-world evidence to the benefit of the Greek patient, all citizens living and patients living in Greece, to the benefit of the society, to the benefit of the economy, and to the benefit of everyone that wants to take advantage of this system.
Thank you very much, Mr. Apostolides. Now it's time to hear the patient's point of view. So, Mr. Kalamitsis.
It's me?
Yes.
Okay, thank you very much. Well, thank you very much for the invitation. Before I start arguing regarding real-world data, I saw in my calendar today that it is the World Health Day, 7th of April, which, by the way, was the same day that WHO was established back in 1948. So 2 years after the finish of World War II, we had the establishment under the United Nations of World Health Organization, which is the scope of the organization was to provide universal health coverage for back then 1 billion people. And of course, above from that, it was to provide guidance and information to member states regarding serious public health issues. And it was supposed to do this by collecting data, real-world data of the populations, the marginalized population or the general public. And through this data collection back then to, provide policies for any kind of health threat back then. So I thought it was important to mention that, even back then, after so many years, we're still talking about the importance of data, real-world data, and how this could improve the health of individuals in specific countries or in everywhere in the world. So, of course, above that, we have to come to today, which is, after pandemic period, maybe not, maybe yes, we shall see. And we saw that during the pandemic, there was a strong need of a shift in a bunch of policies that happened, in a strange way. But this gave also the opportunity. The pandemic gave the opportunity to make fast-track changes in policies that, in any other circumstances, probably will take years of debates of democracy and public health, and this will be continuing for probably decades before serious projects will be implemented, like probably the ηλεκτρονική συνταγογράφηση, correct me for my English. So there were some significant changes and important ones. So I come in this conference and I had the opportunity. I'm always one of the lucky ones because I had the opportunity to watch a bunch of panels that talked about real-world data and the use of it. And I had this fantastic presentations a few minutes ago, which explained a bunch of the things, most of the things, why this data are important and the benefits and the standardized procedures that we need to come to find in order to collect the data and make the best use of them for the patients. But I think this is important to share a few of not personal, it's kind of a personal experience that I had with the lack of having this data in order to implement policies and provide health to individuals. So the first one was a few years ago when I was assigned as the president of the Committee of Patient Rights of the country, and I was in charge of 50-something χώρους in the hospitals. There was the patient departments. Thank you very much. Thank you very much. There was there was department in each one hospital, and they were supposed to, over the individuals, go over there and ask and provide for some complaints or applause the staff of the hospital. And when I realized that, the first thing that I realized is that, unfortunately, every hospital around the country collects the data in a non-standardized procedure, which is unfortunate. The thing is that you cannot come to results and you cannot, provide with specific policies of change, even in this specific service. The other one, which was also not as a good experience, but I think it's important to mention, it was back in 2014 when the industry had the opportunity to bring a significant change, innovative treatment that back then was treating hepatitis C. And in order for someone to understand the difference, before 2014, we had drugs that could not cure hepatitis C with significant side effects. Patients did not want these treatments. So even though we had the opportunity to have the super duper technology, the super duper innovative treatments in our payers were ready to reimburse them, unfortunately there was a huge debate back then where the patients are. And the country had no clue where to find the individuals that they were supposed to treat. There was a huge argument between clinical society, civil society, epidemiologists. Where are the high-risk populations? And unfortunately, this led to a significant waste of resources back then. And unfortunately, of course, it made a huge years of delays of people accessing innovative treatments that were supposed to save their lives. So, above all, I heard some very good, very promising things today in a bunch of panels, not only today, not only in this one. But I think what I'm missing from everybody is the sense of emergency. Out there, we have significant unmet medical needs. We have an aging population in this country also, which is there and is continuously asking for healthcare services. So it is promising, it is promising, of course, that we have heard from government, that are planning and to make standardized procedures, and ODP was previously, a few minutes ago in another meeting, ODP was there and sharing very promising ideas and plans, and the industry, of course, is supporting, thank you, real world data, but I think we need a little bit to speed up. So I think I took a lot of time. Sorry for this, and thank you very much.
Thank you very much. Now it's your turn, dear professor, to tell us about the survey you made.
Thank you. Yes, indeed. Well, I missed all the arguments that I could say now, but I will wrap it up a little bit. Yes, indeed, we started, we were commissioned to do this study at U of A and the National Technical University of Athens. And we started this study actually to measure, not only to measure, but also to identify what are the basic problems for not proceeding with that. When we started, the benefits have been discussed already, and they are pretty much obvious for everyone. A lot of people, and there's a lot of literature now that they show what kind of value real-world data, when they are collected, they can be created, and what type of evidence you can build on. So, actually, the question of what is happening in Greece, and why is it what it needs for this project to proceed. So, actually, we find we are in a very good shape. Actually, we have a lot of databases. We collect data for more than 10 years, electronic prescription. There are a lot of databases there, so why not proceed with that? And we identified this regulatory gap that there is. We identified that there is an interoperability a problem over there. So, but the problem is not that much the technical one. It's not a technical problem. It's a matter of identifying what are the bottlenecks, who takes the responsibility of such a project and actually runs it in the public sector, and tries to merge all this information that it is there. There's also another concern about the privacy and the security issue that we should not downplay. It is important. There are concerns, and we need to address this. But these problems have been solved elsewhere. We do not have to reinvent the wheel. There are best practices that we can do, Karolinska, Maccabi, and other, the Finnish data, as it was said by Agata. So they have solved, they have found a way, and it is a pity for us. It is an untapped potential to have all this data and not be able to use them. So In our study, we have also tried not just to convince our readers and the public about the benefits of that, but also to quantify the effects of creating such a center of excellence. We find that there are all the elements are there to do such a center of excellence in Greece, and we quantify what is the effect in the economy, because it is a discussion that it is very relevant. And indeed, we find that for every 1 million euros that you spend in this subsector that we created, actually a virtual sector that encompasses all the actors that are involved in this ecosystem, you get your money back. You get your money back and you create 13 job positions, which may not seem very, very, a big number, but they are very high quality jobs. It is not just creating, a storage something or something like that. It is high quality and highly paid jobs. But still, the benefits can be diffused to the system and have better services as citizens and the hospitals and everything. There are so many. We did not have time actually to quantify all these things. What we propose in our study is indeed that such a center of excellence is something that can happen. But again, it's a regulator. It is a reform that does not have a fiscal cost. We have problems in Greece. We cannot do reforms because they cost or they touch upon certain stakeholders, private benefits. But this is not the case. This is something that you need to address certain concerns that are there, and someone, to take the lead, see it as a project, and proceed with that. And we have suggestions in the form of a roadmap of how to do it, with short-term actions, mid-term actions, and longer-term actions. And this is, I believe, the value of our study. And indeed, it is a great opportunity right now because we have the money to do that. We have RRF. Usually we could say this is a nice idea, but you do not have the resources to do that. We are not there. We have the money to do that, and RRF is asking for mature projects. And this is something mature that can be materialized. And so it's a unique opportunity, I think. And but again, not just to be simply optimistic. Someone has to take the lead in this and identify it to take the ownership of such a project and coordinate all the actors that are involved. That's what.
Thank you very much. I would like to ask some questions. First, Mrs. Jakoncic, I would like you to tell us, do you think it is possible for Greece to produce real-world evidence?
I think we have all the discussions, and just to build up on Professor...
Yes, but we also heard that there might be a few obstacles, such as the regulations.
I think, that, to comment on that, nothing it goes without obstacles, and I don't believe that in any other country where they have real-world evidence, we talk about Karolinska, Maccabi, Finland, that things are going smoothly. I think there are the roadblocks, but if there is a will, if there is an interest that if we believe on the benefit of real-world evidence, and we have just heard, the patient perspective, we have heard that we can do it because it brings economic growth, it brings high-paid jobs, then there is a way to overcome those obstacles. Definitely there is one of the obstacles of protection, on anonymized, the data. But that has been already proven that it can go over it, with many countries. And to build more on that, why not take this unique opportunity right now? Money is there. Post-COVID is even more interested to get any type of digital data. New healthcare future is all about digitalization. It's more difficult to go to the doctor and everyone. So the one who will be first utilizing the data will be also the winner. And I'm saying, in this part of the world, there is a unique opportunity to overcome, find a solution to roadblocks, and move forward. Because there is a big benefit, and the patients will benefit, the country will benefit, the economy will benefit. So everyone will benefit from that. Mm-hmm. And it's a great opportunity for improving public health as well. Because if we put the very specific measurements there and KPIs, just speaking about, I don't know, like certain cancer can be eliminated with the right processes, with the right initiatives. Certain cancers can be eliminated. Why not put it, there? And find the roadblocks. I think we should not hide ourselves behind roadblocks, but find towards the solutions how to implement that.
Mr. Apostolides, I would like to ask you something. Before you referred to certain practices from other EU countries. If you could just give us an example, explaining what do you mean?
Yeah, we heard from the panel Maccabi, Karolinska, and Finland, the Finnish FinData. And if we take this analogy, specifically from Finland, operating under the European framework, operating under the framework that anonymized data is protected by all means, refer to the GDPR protection that was in place as of May 2018. We have the framework to move forward. And since the FinData was put in place 3 years ago, we have the results. We have the results that over 700 requests have been made to FinData, both from public institutions and private institutions. Why? To gather insights and move forward about, what are the health outcomes of the citizens of Finland. And decisions have been made based on the FinData. So, and income was generated that was, which is something that we also are looking for in terms of funding public pharma expenditure, healthcare expenditure, and we're looking where to find it. Well, this is one source that we can find that. So why not create Greek data, just like FinData? So we have a saying in English, which is, when there is a will, there is a way. In Greece, I think, though, we are in the opposite extreme. I apologize, I'll use a Greek expression. Our people are saying, όποιος δεν θέλει να ζυμώσει, 40 μέρες κοσκινίζει. In a broad translation, if you don't want to cook, you pretend you're looking for the ingredients. So Mr. Tsakanikas eloquently presented that we have the funding, we have the data source, they're ready as the Institute to move forward. So why hesitate? We're asking for investments. All ministers are here looking for the next day. So, and we also should not forget that we're in Delphi, under the shadow of the Athens rocks. We have the God's will. We have also sipped from a glass of water, which is, if we say the analogy, the inspiration of Castalia fountain. So everything is with us to move forward and practically help our country to move forward in finding solutions, also with real-world evidence.
So, Mr. Kalamitsis, since we hear all that information, is there anything that concerns you as a patient?
Well, I think as an individual, a civilian of this country, I think I would go back a couple of questions. Data protection and human rights in general should never be considered as an obstacle. It is the frame in which we should operate within, not an obstacle. It might be more difficult having data protection, but this is the only way that people will feel secure to provide information in any kind of information, in any source. The other thing that it is a little bit concerning is that I think that there's no other way. There's no other way. We cannot continue providing healthcare as we did back in the 1980s. This needs to be changed. We need to become faster. We need to be more effective. We need to be more cost-effective in what we're doing. So we had a fantastic healthcare system that was brought up between 19 and 1990. But now I think we need to change, and real-world data is a way forward.
Dear Professor, you said before that the potential benefits are multidimensional, if I remember right. And you said more than once that the regulations should be addressed. Do you have any suggestions about how this could really be achieved?
No, as I said, and for building up also on the discussion that we're having, yes, it is again, it is a matter of ownership. As so many reforms in the country, in order to proceed, you need to put everyone in the table. You know, sometimes there are politics or there are concerns. You know, some people believe that they have the responsibility of doing that, or this is my property, this data is my property for the public sector, which is totally insane. And you need to coordinate these people and explain to them that there is value in the country. This is a discussion that it is not a luxury discussion. I know all the problems that we have. The macroeconomic environment is very difficult. We have war, we have everything, and some people may say that this is a luxury discussion, but it is a very relevant discussion for Greece because we're looking for sectors and areas that we can build on and create value. Okay, we say tourism, we say other sectors, but this is something that we have it, and we need to, but we need to invest in it. Nothing comes automatically, you know. So this is something that we focus, and I also believe that the society now is a little bit more open due to the pandemic. You know, people are a little bit more confident in providing data for that. It may not be that easy before the pandemic, with all the vaccination process and with mobile, that you get all the information that you need and you feel that you are connected to a system. I believe that the society is more open and more eager to accept such changes and be part of this. And I'm not saying that we should downplay the concerns that people have about security. We should address them. We should not say, you know, they are fools or they do not know what they are of low, I don't know, education or whatever. We need to address these concerns. But I feel that it is also another, and I forgot to say that the society, I think, is very open to hear that, and we see the progress. So yeah, okay. This is what I think.
Another question for Mrs. Jakoncic and Mr. Apostolides. Is there a slight chance that maybe in the years to come, real-world evidence could stop, in a way, clinical trials?
You want me to answer? I think we have to have a difference. Randomized clinical trials are prospective type of analysis. Real-world evidence gives a different perspective. They give a clinical practice. So I don't think, that can ever happen. But real-world evidence can be a good source for shaping a new randomized clinical trials based on an outcome from real-world evidence. Could be a good input, how you shape it and create the new clinical trials, number one. Number two, I think that randomized clinical trials, is, as I said, very prospective, defined and so on. But then it is a broader audience. So we need to have this input in order then to help and shape it, the new innovation. Moreover, when we talk about genetic therapies, the real-world evidence is very critical and very informative because you cannot have so much randomized clinical trials going forward. So I think, that it can more be exclusion, but it's more about how they work and complement each other together. Okay, so you want to add?
Yes, very insightful question, and there is, as you mentioned, Agata, complementarity between the two. One is looking prospectively. Clinical trials, we have all of us, from the pharmaceutical industry that we're representatives of, therapies, innovative therapies, as we heard from Mr. Kalamitsis, we have therapies that cure. Hep C was one of them, examples. Also, in cancer, we're close to that, both in hematological cancers and in solid tumors. We're very close to that, breaking that barrier of having a complete cure. So this should not be underestimated. So looking at clinical trials moving forward, whereas real-world evidence provide us insights of our informed decision-making, what needs to be taken into account, how do we accommodate our expenses as a Ministry of Health, as a government, and based on that have informed decisions on how to move forward. And This is why we're advocates of you need to fund innovative industry to move forward, because that brings benefit to the patient, to the healthcare system, to the economy, to the society, in order then for established therapies and when patents expire to provide the framework for the local industry to flourish and allow cheaper medicines to come to market. And I'll close my statement with the example of, let's look at the pandemic. We had like a vaccine in less than a year, where normally we know it takes between 5 to 9 years to have a vaccine in place. Equally, we had targeted therapies that in other sectors it takes more than 10 years of research to bring a pharmaceutical to market. We had targeted therapies for COVID in less than 2 years. And although it's very sad to mention that we had like 6 million deaths, but if you look back at the analogy of the first pandemic at the end of World War I, we had over 50 million deaths. So it shows that we can progress and make informed decisions on how we protect the people, the patients, the society, the economy moving forward. And us, we play an important role in bringing those solutions to place. And we want, we addressed all the solutions from our part, how to move forward and combine the two, real-world evidence with clinical trials, which is an opportunity for Greece.
So let me stick a little bit more on the clinical trial subject, which is one of my favorite, by the way. And I would like to ask you, Mr. Kalamitsis, do Greek patients hesitate to take part in clinical trials? What's the impression that you have?
Well, the patient of the society again. I think not only patient. I think that there is of course there's two different categories. First of all, if there's a specific health need, so an individual has a specific health need, of course he is willing therefore to go to a clinical trial, and he's not he wants to resolve the problem here and now. And if there is an alternative to go to a clinical trial, that will accelerate access and probably have a potential of a highest rates of cure. Most of the individuals are willing to go in a clinical trial. Of course, when there is not a health need, and that's the biggest population, most of the individuals are skeptical, and the lack of information and the regular stuff that we have seen. There's even in the national agency there's of course sections that could eventually somebody be informed regarding clinical trials, but that information should be a little bit better written and in a more understandable way for individuals. And there is a bunch of fake news regarding this procedure. We saw all this happening in the pandemic with vaccine. Of course, this influences also clinical trials.
Okay. Mr. Tsakanikas, I realized hearing all of you today that we are almost half the way there in order to make a center of excellence in Greece and for real-world evidence to be produced in our country. Is this the next step, or should we make a few more steps?
No. As I explained, we have the data, we have the money, and it's really a matter of will actually, and someone take the lead in this. And because also I have been studying the pharma sector in general and
for many years.
For many years. So even for clinical trials, we have done extensive studies, try to convince for the value of them for bringing them to Greece. I understand again the society. Gradually, me myself also, I feel that we should always try to address this, and this is the way to take part. You can obligatory, impose anything you want, but you have it's a step-by-step process, and you have to raise the awareness of the people of the benefits of this and what it actually means. Now, indeed, with the social media and with fake news and everything, it's very easy for some policies to be misguided or to be misunderstood, and it's a step-by-step process. It needs patience. Things do not change overnight. You need to achieve this. This is quick wins, as we say. Okay, but I hate this word. Okay, but you need to step by step proceed to your policies. And I think we are there, and we're in a way, it's an opportunity. We have a golden opportunity right now.
It's a pity we don't have with us Mr. Habibis, because I think it would be very interesting to hear what the government is going to do about all this useful information that you shared here today.
If I may, because when we I do not want to replicate him, but because he was present when we presented the study, he said that it is in the intentions of the Ministry of the Digital Transformation to go ahead, and they have been doing various, they have taken significant efforts to do that. So I got the impression that it is something that is high on their agenda, and that it is something that we can hope it can proceed.
Okay, so I see that we have almost 4 minutes left. Another quick questions to you two. How do you think that the real-world evidence could make healthcare ecosystem in Greece more effective and more efficient?
I will go back, to what I already discussed it before. So, when you decided to implement real-world evidence, when you decided to make a KPIs or performance indicator to try to measure, then you can take all the decision. What cost-effectiveness treatment, if you want, we can use it. What type of procedures we are going to follow. What type of prevention measurement we are going to follow. So it's all about, the decision, the will. Are we going to go there? Are we going to use the data to get some evidence out of there? What is a KPI that we want to put it there? What do we want to measure it? By when? And that, I think, it is with the reverse loop. You can look at how effective your system is. It can help to prioritize where the government will invest one by one. Not everything can be done in the same time, but it helps, different prioritization. What is the biggest burden today? The biggest burden is make a cost-effectiveness treatment. So if you measure, then you know what you want to achieve. So I think this is the basis, that it's only the will, and I'm really happy, that Ministry of Digital Affairs is willing, to go in this direction. I think, there is a will there, and it's going to happen, because that's a new future.
We're here to see the future coming. So we are eager to see it. Yeah. Mr. Apostolidis, a comment from you?
I would look at it, because, there's nothing more I can add to what Mr. Jakoncic mentioned, but I would look at it from the health payers' point of view. What are they looking for? They have pressures from different segments of the pharmaceutical industry, from patients, from the hospitals, and they we heard that they want to transform healthcare system to have a primary healthcare system. And we've seen that we were close in collapsing our healthcare system because we didn't have enough primary care healthcare system. So this kind of initiative will provide us that kind of answers to our claims. We're saying, have the best treatments of all. They have the means to measure that, and in specific time frames to look back and say, look, this is, to me, this is cost effective. We heard have cures, we have improved outcomes, we have a better quality of health, of care, we have better quality of the patients, we have extended the life expectancy to over 82 years. We can go even further, and this is all attributed after the chlorination of water and after the better nutrition. The pharmaceuticals are responsible for the expanding life expectancy. So why not? We are at the verge of taking advantage of this, what we have in our hands. So my conclusion is that this is the point, this is the outcome that create the Greek data, just like the Finn data, and move forward with something that will be benefits to all.
Let's wish that we can make it, and next year here in Delphi, hear the announcements about that. Thank you all very much. I think it was a very productive panel. Thank you all, ladies and gentlemen.
Thank you.